Here we have an upper right first premolar with a non-carrier cervical lesion which is to be restored using composite. We're bonding to 2 to 3 millimeters of enamel without a bevel to conserve tooth tissue. They try to increase the surface area as much as possible. The shade here is being planned, and we've got the shade guide arranged in order of value, meaning going from the lightest to darkest. As we can see here, we just slide it along, and as we can see, A35 is looking pretty much like the right shade. However, we're going to go and check all the other shades just to make sure. Like I said, the shade guide is all arranged in order of value, going from B1, A1, B2, D2, A2, C1, C2, D4, A3, D3, B3, A3.5, which is what we're using, B4, C3, A4 and C4. Now the good thing with arranging it this way is that with it being arranged from lightest to darkest, as you slide along, you very quickly and quite easily can find what is most appropriate. However, I seem to be dithering around a little bit with this one. But we did come to the A3.5 first of all, and I think that's probably the most appropriate shade there. Again, it's not an exact match, but the good thing with using this technique is that it allows the shade of the natural tooth underneath to shine through and just blends in and gives a nice harmonious finish, because we're spreading the composite across to 2 to 3 millimeters of the enamel, and where this is quite thin, it will allow a natural gentle transition from tooth to composite, and it just gives a nice harmonious result. And here we can see finally we've decided on using the A3.5. The enamel then is etched first of all here. You can see to about 1 to 2 millimeters beyond the planned margin, and we plan to etch to about 3 millimeters of enamel, which means we want to actually etch about 5 millimeters or possibly more of enamel. And this allows for a gradual change from filling to tooth, and it results in a nice harmonious aesthetic result. It gives a blended aesthetic result, as I've written here, in terms of the shade. And we don't really want to etch dentine for any more than 15 seconds, so the etch is rinsed off and the tooth is being dried. Obviously you can see here we're not using rubber dam. Rubber dam in class 5 lesions can be a bit of more of a hindrance than a help. Obviously we're working down by the gingival margin. Anywhere where you're working by gingival margin, rubber dam would really get in the way. So the tooth is rinsed and dried. We're then going to apply our primer. In this case we're using the Optibond FL Prime. This needs to be applied for about 15 seconds to both enamel and dentine. And the primer does a couple of things. Obviously it increases bond strength, but apart from increasing bond strength, it massively reduces any sensitivity. For example, in this case we've not used any local anaesthetic, so the tooth will be quite sensitive after we've washed the etch off. As soon as we apply the primer, it reduces any sensitivity. Now, after applying the primer, the tooth is dried. Now I like to apply about 2 to 3 coats of Optibond FL Prime. This is not absolutely necessary, it's my little OCD. However, it helps me sleep better at night. I know that all parts of the tooth are fully covered, and it just gives a better long-term result, I think. So you must remember, this is not absolutely essential, it's just my little OCD. However, I don't think it particularly does any harm applying more coats of prime really. And then the Opti-Bond FL adhesive is applied and air thinned. Again, we're applying this with a light brushing motion for about 15 seconds. And then this is air thinned. And we want to light cure this for about 20 seconds using a 1000 milliwatt per cm squared light. Now if you were to be using a more powerful light, you could get away with curing for a shorter period. For example, if you're using a 2000 milliwatt per cm squared light, you could cure for as little as 10 seconds. However, if you're using a less powerful light, for example 500 milliwatt per cm squared light, you'd want to cure for about 40 seconds. Either way, giving the same amount of light energy. Then in this case, the composite I'm using is a Feltec Z250. I've been using this for 12 years and it works very well in my hands. The composite is then shaped with a carver or flat plastic and then smoothed over using an inside-out glove. Now obviously there's a little dimples on the glove. Using an inside-out glove, it will be smooth, so you create a nice smooth polished finish which doesn't require an awful lot of polishing afterwards really. And then the composite is light cured for 60 seconds with a 1000 milliwatt per cm squared light. In study 1, which is where they achieve their best long-term success rate of 91% 10-year survival, they cured for 40 seconds with a 1000 milliwatt per cm squared light. I think curing for longer periods can only result in more thoroughly cured composite and stronger composite and therefore more durable results. Again, remembering if you have less powerful lights, you will need to cure for longer. If you have more powerful lights, you can slightly reduce these curing times. Now obviously in class 5 lesions, we're not relying an awful lot on strength because they're not really in occlusion or anything. However, if you imagine you've got an upper molar being used, we're going to need a much stronger result, and I would recommend curing for even longer periods for posterior teeth in occlusion. Now you can see here it's pretty much finished. We're just going to clean up the gingival margins a little bit with a fine narrow diamond. In this instance we're not using any water spray at all, just so we can see a little bit better and save drowning our patient for the moment. I have to excuse my head getting in the way. There we go, so we can see a nice polished gingival margin there as well. We could quite easily leave it like this now. However, it's well worth then going over it again with an ultra fine composite finishing burr. However, when using the ultra fine, we do need to use water spray, because if we use these without water spray, you'll burn your burrs out. So we're just going to go over and check over any bits that need a little bit more polishing up there. And as you can see, the shade and the aesthetics of it are looking very good there, using very simple techniques. So here we have the finished result. You can see that we have a good looking restoration. So what can we conclude from these? Quite clearly, 3-step bonding is more durable than 2-step and self-etch. We can also see that enamel bonding is more durable than dentine bonding. Study 1 is the only one where they've used 1 to 2 millimeters of enamel to bond to, and this definitely gave better results. And more light energy will definitely give us better results, because if we have properly cured composites and properly cured bonds, they're going to work as they're supposed to. Now, more light energy can come in the form of either curing for longer or using more powerful lights. We can also see that using rubber dam does not necessarily improve survival. Study 3 did use rubber dam, yet they only achieved up to 26% 10-year survival. So rubber dam does not necessarily improve survival. But what is most important is using tried and tested materials and techniques works.